All right, let's do AV Blocks 101. Before we get started, it's really important that you know what your PR interval is. A normal PR interval is 0.12 to 0.2, and your normal QRS interval is going to be less than 0.12. You have to know what's normal before you can know what's abnormal. And an AV block or a heart block is typically when there's something blocking the electrical activity from going to the next piece. So typically you'll see either an elongation of your PR interval, your QRS, or even a complete block between the two. And we'll talk about all three of those in just a minute. First, let's look at the first degree AV block. What you can see in this rhythm is you've got a P wave, a QRS, and a weird looking T wave. Ignore that for right now. So this would still be considered a sinus rhythm, even though there is an AV block. A first degree AV block is when your PR interval is greater than 0.20. Not terribly specific, but an easy way to remember this is that each one of these large boxes here is the same as 0.20 seconds. So just looking at this one, we know this is going to be a sinus rhythm with a first degree AV block. So your second degree AV blocks are going to be two types of second degree AV blocks. You have your type 1, Mobitz type 1, or what's known as Winky-Bach, and Mobitz type 2. The way I remember this is you still have that elongation of your P wave, but it goes long, longer, longer, drop, Winky-Bach. So both of your type 2 AV blocks end with a dropped beat. But for Mobitz type 2, it's going to be there, normal, normal, and then all of a sudden just a randomly dropped QRS. So remember, Winky-Bach is long, longer, longer, drop, Winky-Bach. Mobitz type 2 is the same, random drop QRS. Finally, I want to look at a third degree AV block, also known as a complete heart block. Now, the other two, they're not necessarily deadly, but each one, as they progress, make it to where it's more likely to throw you into a deadly rhythm. Third degree AV block is the most dangerous of these heart blocks. And what you need to know about a complete heart block or a third degree AV block is that the P wave and the QRS are no longer talking to each other. If you could march these out, your P waves, they're just the same all the way across, all the way across, all the way across, all the way across. And the same thing is true for your QRSs. You see that they are exactly the same. They march out. But the problem is that they're not talking to each other. They're like a married couple who, they're still living together, but they're not really communicating. That's what's happening. So the P wave is going and the QRS is going, and what could happen is that you end up having some overlap where the P wave and the QRS, the atrium and the ventricles, are actually beating at the same time, which could easily throw you into one of the deadly rhythms.